Acid. Today discussing benzoic acid, which is one of the integral remedies that everyone needs to use, and it's not everyone should use or everyone can skip it. Kind of, you will need this remedy in all or majority of cases of uric acid diathesis. So, Dr. Rux, glad to see you join. Few people on YouTube. So, this remedy, the first line mentions that this is a gouty rheumatic diathesis remedy engrafted on a gonorrheal or syphilitic patient. So, the patient will have lingering troubles which are going on for a long time, structural changes are there, pathological changes are there, and the patient presents to you with some joint pain or some disturbance in the urine or urinary organs. That's where we should think of benzoic acid. So Mani Nigam, the second person to join, Neha Yadav, and few other joinees on YouTube. Dr. Ajmal Saif, welcome. So we are discussing benzoic acid, and I hope so far, if you have attended whatever sessions I have conducted on Alan's keynotes and other excerpts that I have been putting from Alan's keynotes and from the workshops, you must have got an idea of how simplified practical knowledge is needed to be dissipated amongst the homeopathic students and practitioners. No method or no uh, new technology is required. You need to only read the source books, your basic books, and that's what will take you ahead in say 80 to 90% of cases. And we are discussing benzoic acid today. The first thing that is mentioned is the gouty patient is presenting to you who has already some structural or lot of pathological changes engrafted on a gonorrheal or a syphilitic patient. Cough with expectoration of green mucus. We see this expectoration of green mucus in very few remedies. It will be seen in remedies which have the disease progressed from the superficial fascia to the deeper levels. It has been lingering since many days. It is a secondary stage of inflammation. That's how you connect with your patient symptoms with the pathology. The other remedy mentioned is natron sulf. You can go and check Kali bichromicum, Kali iode, and green discharges remedies, where you will find that these all are similar remedies that are going to be your, your prescriptive pointers for such cases which have progressed to secondary or tertiary stages of inflammation. And what is the next line is that there is extreme lassitude and weakness, and there is weariness. So this is common to all the acids, and I told yesterday in the previous session for acetic acid that all the acids will have this component of weakness, lassitude, weariness somewhere in their presentation. You will either observe it, which is more beneficial rather than patient telling, because the patient may feel the weakness after a lot of time when the disease has actually progressed to majority of the organs, but your observation would pick it up much faster if you are habitual to it. So glad to see our regular Dr. Ruturaj Chaudhary and someone named as Minu. We are discussing benzoic acid, and I hope some of the ideas that I'll be putting forward will help you prescribe this remedy. It is going to be a majority of prescriptions for uric acid diathesis. Do not ignore it. All our stalwarts have given this remedy left, right, and center in all the cases of uric acid diathesis. So whenever there is pathological component, think of these organ remedies, think of these remedies which will cause these biochemical changes in the body. Otherwise, you will forever keep curing them with your constitutional medicine, and nothing is going to help take the patient further. So you have benzoic acid, which also has a very interesting symptom from Allen's keynotes, which is diarrhea of children, white, very offensive, exhausting liquid stools running right through the diaper. Podophyllum is another remedy mentioned. Urine is offensive and of a deep red color. So offensiveness is a part of benzoic acid. Offensiveness is a part of podophyllum. You will have to differentiate based upon certain other modalities, or you'll have to see whether it is a dark yellow color which points to podophyllum, or just a watery kind of stool which would point to benzoic acid. Urine dark brown and the urinous odor is highly intensified. Many times you can ask this to patients, what is the smell of urine? We either feel shy to not ask these questions, or we don't feel the need to ask these questions. The problem is that all these questions, the nitty gritty things of physical generals, what happens when you pass urine, before urinary passage, after urinary passage, during the passage of urine, what happens when you pass stools, before stools, after stools, all these nitty gritty things will give you something which is very peculiar for prescribing and picking up certain remedy which is going to be your sheet anchor in that disease. So benzoic acid gout में कैसे repeat करना है, wait till the end. I will definitely give my suggestion what I do in my cases and what I have read in different books. In the urinary system for benzoic acid, you will see enuresis nocturna of delicate children, dribbling urine of old men with enlarged prostate, strong characteristic odor, excess of uric acid. So many cases of nocturnal enuresis we are giving constitutional, there is no doubt about it, but there will come a stage where the habit doesn't go. There will be a certain stage where the smell doesn't go. That is where you can think of benzoic acid as one of the remedies. This is going to be one of the remedies along with creosote, along with equisetum, and other group of short and small remedies that you can think of in nocturnal enuresis. Catarrh of the bladder after suppressed gonorrhea. Now gonorrhea is non-existent, barely seen, but its effects in the future generations are seen in terms of joint pains, swellings, other discharges. So think of recurrent cystitis as a manifestation of gonorrhea from the past. That would give you an idea, and this remedy can be of great help in such cases. Gouty concretions, arthritis vega, affects all the joints, especially the knee. Now interesting thing is that how many times the knee is affected in the uric acid cases? Very rarely, because it is a big joint. Accumulation of uric acid in such a large joint takes a lot of time. It may be like 10 years, 8 years, something like that. But if it happens, this is the remedy you can think of. Chances are that it will not happen till the patient is with you on the right medicine, if you have given the specific medicine. The joints getting affected in the initial stage itself with a highly urinous odor of the urine or the perspiration should give you enough courage to prescribe benzoic acid, frequent repetition for uh, 15 days, 30 days, check the urine routine again, and you will find some changes, because these are biochemical changes which will happen for 15, 20 days, 30 days, and then you will see the result. It is not going to be immediate like a platelet count increasing immediately. Okay, and that's what you see, that the gouty concretions are there in all the joints. It can happen in the knee joint also. There is cracking on motion and there are nodosities. So there are gouty concretions and there is kind of a swelling across the joints which the patient will report to you, and that's where you should be able to prescribe benzoic acid with all the other components. There may be some weakness, there will be some urinous odor, etc. etc. Berberis, lithium carb, and lycinum are the other three remedies that have been mentioned in relation to this presentation. In the joint pains, you will have tearing, stitching in the large joints or of the big toe. Most of the patients will report to you the big toe is affected, especially in initial cases of uric acid deposition. Benzoic acid should be started right away You can give thrice a day 30 potency for 15-20 days. See the patient again, repeat it the same for another 15-20 days and get the reports done. You will see some changes which are beneficial for the patient and also for you to see in the reports. So you have the big toe affected and redness and swelling of the joints, and gout pains or gouty concretions affect the patient mostly at the night rather than throughout the day. So that brings us to the end of benzoic acid, which is one of the important and most often prescribed remedies in uric acid diathesis. Do not forget this remedy if you have a patient of gouty diathesis, or someone who is always complaining of joint pain, someone who has uric acid in the reports but there are no physical manifestations of joint pains. The problem is in the initial stage, it is in the beginning phase of the urinary tract, of the chemical processes. You can start benzoic acid once a week or twice a week with your constitutional medicine, and that should give rest to the biochemical process and reverse it and avoid a complete deposition of uric acid in the smaller joints. This remedy, benzoic acid, is similar to Copaiba, Kalinitricum, Ferrum, Thuja. So we saw that in some aspects it is similar, like in discharges it is similar to natrum sulf. I spoke about Kali remedies. You have here Kalinitricum in the relationships. Ferrum and Thuja, of course, Thuja being a gonorrhea remedy, antipsychotic remedy, should be related to all such remedies which have the appearance or suppression of the discharges which should naturally come here. And you should see that Thuja and other remedies are antipsychotic remedies. Whenever you think of antipsychotic cases, uric acid patients, you should give a thought to Thuja and all these remedies like medorinum. You should give a thought to benzoic acid and other antipsychotic remedies. You can see also a mention in the relationship about Kalinitricum. If the Kalinitricum as a remedy in nocturnal enuresis has failed, which is interesting because we don't come to Kalinitricum very often to prescribe, but over here it is mentioned that if you fail to give Kalinitricum, benzoic acid should be thought. It is very rare for a homeopath to give a remedy which is benzoic acid to a patient of nocturnal enuresis, to a child especially, but a highly urinous odor or the perspiration which is offensive or smelling very bad, that should give you a thought of benzoic acid with some weakness element present. And berberis and lithium carb are present as a relation to this remedy in all the joint complaints. You can also think of colchicum as a remedy in gout complaints. Benzoic acid is one of the differential diagnosis as a remedy. Differentiate it using the physical generals rather than anything else, because these are smaller remedies. They will give you more physical generals than the mental generals after abuse of Copaiba in suppressed gonorrhea. So Copaiba has been mentioned right from the beginning in the benzoic acid at many places as a related remedy, so it is worthwhile to go and look over at Copaiba. Recurrent urinary tract infections, you should think of Copaiba with lot of discharge with the urine passage. When patients are on benzoic acid, alcohol or wine needs to be avoided. It is mentioned that it aggravates the urinary or gouty or rheumatic affections. Now you go behind the pathophysiology of how these things will affect, and you will see that there are a lot of biochemical processes of urinary or rheumatic affections which keep on affecting the patient. That's where benzoic acid will go as a remedy, being a chemical compound of various carbon and hydrogen elements. It will go and break that process, put things right in place and give result to the patient. So in all, you have benzoic acid for gouty patients or for patients who are developing uric acid issues. In the beginning, the big toe is affected, there is urinous odor, or in children's cases there is nocturnal enuresis without any cause or dribbling of the urine. In elderly people, think of benzoic acid. So it brings us to the end of today's session of benzoic acid, and we'll stay in touch with the other future acids. Lot of acids are there. There is muriatic acid. There is lot to discuss. More Bovil monosodes are there, and we'll ultimately finish acids in this month from the Allen's keynotes. So those who have joined later on, you can go again and watch it again if you wish to learn something interesting, which is just from our basic books. No method, nothing which is extraordinary. It is just plain simple homeopathy, which is practical and you can apply in your practice on a regular basis. So if you found this helpful, let me know in the comments also.